Welcome to Microdose Psychedelic Insights, powered by the Conscious Fund. This is the PsyFi series, discovering the cutting-edge science and research in psychedelic medicine.
Welcome, everybody, to another exciting episode of the PsyFi podcast, where we talk to leading industry experts, clinicians, and researchers to unravel the mystery that is psychedelic medicine. Today, I'm so lucky and fortunate to be joined by Dr. Erica Zelfand. She's a family physician, and she's launching our first accredited Cme course for us to help clinicians and physicians learn more about psychedelic medicine. So, Erica, thank you so much for joining us on the show. I really appreciate it.
Thank you. It's my pleasure to be here.
So we've had the opportunity to connect over these last few months and, work a little bit on the course, and it's something I'm really excited that we're launching. But for our audience, it'd be great if you could just introduce yourself a little bit and, talk about what you're doing with Microdose. I think that'd be great.
Yeah, sure. So I'm Dr. Erica Zelfand. I'm a family physician, and I specialize in integrative and naturopathic medicine. And I do a lot of mental health in my practice, so much so that I quickly realized after opening my practice, yikes, I need to get way more tools in my toolkit for dealing with mental health, because far too many people are living with depression, anxiety, ADD, ADHD, autism spectrum disorders, a slew of other neurological conditions that affect our cognitive functioning. And it didn't take too long after I pulled on the thread of mental health for that to lead me to psychedelics and to the role that these powerful medicines can have, not just on spiritual experiences and quality of life, but also on our health, on our mental health, and even our physical health. And so that has become an area of interest or a specialty, if you will, in my practice, but also for me academically. And, there's this haunting statistic in medicine where it takes, on average, over 17 years for good evidence-based data to actually get incorporated into the day-to-day practices of a physician in practice. And when I looked at psychedelic medicines and the compelling indications for their use, I realized my colleagues don't know enough about this work. This is not, the Further Bus and Timothy Leary and the Summer of '69, although, LSD and psilocybin were there for that too. This is rigorous scientific data showing that people who are struggling from conditions that we're really not treating very well in conventional medicine, we could be saving lives if we understood these medicines better. And if more of my colleagues would be willing to just consider for a minute the potential merits. So what I do, aside from practicing and seeing my own patients, is I teach courses for healthcare providers. I do grand rounds at medical schools and institutions. I speak at medical conferences. And what I've paired up with Microdose to do is I've actually turned my day-long training for healthcare providers into a web-based course that's entirely self-paced online, and it's actually designed for healthcare providers that don't know that much about psychedelics, that want to be able to have intelligent and nuanced conversations with their colleagues and with their patients.
Wow, that's incredible. There's so many things I want to comment on and ask you about based on what you said. But it's really awesome, to hear that you're so forward-thinking and progressive about psychedelic medicine and so willing to educate and help other people in the field, especially clinicians and physicians and the people that have the power to really use this medicine and save lives with it. And, that daunting statistic may be true, but what's so cool about the psychedelic renaissance right now are the amazing stats that are coming out of what these medicines are able to do for people as far as treating addiction and autism and PTSD in ways that, we could have never thought possible before. So just as, scary as the stats are for things like major depressive disorder and addiction, I think on the other end of the spectrum, we have some really promising medicine and therapeutics ahead of us, and it's really cool that you're at the forefront of all of that. So Thank you. It's been awesome, to collaborate with you through Microdose. I'd love to hear how, you said you pulled in the thread of mental health and you got into psychedelic medicine. If you could talk a little bit more about your journey, into becoming a doctor, and maybe was it an easy thing for you to accept that paradigm and get into psychedelic medicine, or was it at first like kind of a challenge for you? What was that like?
It was actually pretty smooth and effortless. It just felt like the pieces all flowed together. I will say that when I went into medicine, I really sort of hemmed and hawed over which medical program to attend, because I think a critique that I have of conventional medicine, of Western medicine, is it's very compartmentalized. It's the mind is separate from the body. Consciousness, we don't even understand. And spirituality, if you want to talk about spirituality, you go into chaplaincy services, right? And even the physical body gets further divided, right? I meet people at a party to say, "What do you do?" "Oh, I'm a doctor." "Oh, what kind?" Right? Do you treat ears? Do you treat hearts? Do you treat vaginas? Do you, do you treat the little edge of the left pinky? And it's so broken up. And so, my philosophy of healing is that, things are connected. Is everything connected? I don't know. But I think things are way more connected than can be accounted for in a typical 7-minute visit,
Yeah.
And so, in my philosophy of healing, which is not unique to me, this is informed by something called the Vitalist Philosophy. So I'm a fan of vitalism. I went to a medical school that emphasized Vitalist philosophy and that emphasized integrative medicine. I love the education that I got at the National University of Natural Medicine. Just want to make a plug for my alma mater there. There's this philosophy of healing where, let's say somebody stepped on a piece of glass and they had a piece of glass stuck in their foot. And then they come see me and they say, "Dr. Zelfand, can you help me heal? Can you heal me?" And the answer is no, I can't heal you. Your body's going to heal itself because your body has an innate, undeniable, spirit-given tendency toward healing and balance. But what I can do is I can put on a pair of gloves and I can take a pair of sterilized tweezers and I can remove the piece of glass from your foot. I can remove the obstacles to healing. And then I can create the optimal conditions for healing. So I could put a little calendula salve or some manuka honey or some neosporin on the area. I can put a clean bandage on it, and I can tell you not to rub dirt in the wound, right? I can remove the obstacles, I can create the ideal conditions, and from there nature takes over. And what is that nature? Is that from within you, or is that, the nature of the plants you put on the cut? It's both. And so the next, to jump from there to, well, here's a plant-based medicine, or here's a synthetic medicine inspired by nature that you ingest that teaches your inner healer and works with your inner healer to come into alignment and heal you. For me, it wasn't that big of a jump to make. It's like, oh, of course, how you feel about your life is going to affect your health. And of course, how you feel about your life is going to be informed by if your spirit is happy in your body. And, how you treat your body is going to affect how happy your spirit is there. And, it's kind of, I don't know, it's just a beautiful spiral of healing, once things get into alignment.
That's really amazing. Something that stuck out to me a lot is the way you talked about treating that, patient with the glass in his foot, his or her feet. You sort of empower them. It's not just like they're going to the doctor that has all the power and they're powerless. You're telling them that their body has this intelligence and they're able to heal. And so when we extrapolate that example to mental illness, it becomes so much more important, that the element of empowering the patient, because I think today so many patients feel, especially the ones that are struggling with mental health issues, they feel powerless, and the medications they're taking are not helping empower them. The Hopkins study to me is so profound. The one that notes how psilocybin being 4 times more effective than antidepressants. And I brought this up in a couple of podcasts because what's so cool about that is it talks about how Antidepressants, SSRIs, for example, reduce activity in the amygdala, and that's where we experience negative emotions and fear. So it sort of shields you from that. But it continuously does that. You have to keep taking these pills to keep kind of clearing that negativity. Whereas the psilocybin increased activity in that area of the brain, It forced patients to have to confront those things, and they did. And then they got better. So many of them, And so I think that's such a really big part of it. And you're right, it's not just the plants, and it's not just you. It's this system, it all goes together. And part of it is us being able to connect with each other. So that's really cool. I would love to hear your opinion or your views on, it's really cool to hear how easy it was for you to accept psychedelic medicine and understand its efficacy and incorporate it into your practice. Why do you think some other physicians still have so much trouble doing that?
Well, I think that I think psychedelics, they got a bad rap. There was a kind of a big smear campaign, if you will, against psychedelics. I think that what happened, with Timothy Leary and that whole scene and Ken Kesey and Merry Pranksters, I think it left a really unsavory taste in the mouth of, the medical industrial scene. And, there's one argument for, you get everyone to sort of get educated and to take the acid test, right? And then there's another argument for, maybe put on a suit and get a degree and walk in through the front door with a briefcase and, let's get at this with some rigorous scientific data. And I don't know which one is right, but I know that the one in the late 60s didn't work so well. And so now we're trying this other one, right? And that seems to be going better. I do know that for me, the first time I took a psychedelic, I had a terrible experience. I had what you could call a bad trip. And when I talk about bad trips in the course, some people say there's no such thing as a bad trip. I absolutely disagree with that. There are definitely such a thing as a bad trip. And in the course, we talk about what a bad trip is and how to reduce the risk of it happening. And as it turns out, a lot of it has to do with set and setting and intention and education and safety, right? I was in an environment in another country with a shaman who I didn't trust, who I didn't like, frankly. I didn't feel safe. And lo and behold, I had a really crummy experience. The next time I took a psychedelic substance was over a decade later, and I felt safe. It was in an environment in which I felt safe with people who I trusted. And not immediately, but that night, I sat up and my eyes bolted open, and I just thought, I need to know what this is doing to my brain. I want to know this. I want to know, why am I seeing these things? Why am I feeling these things? What's the chemistry? What signals are being fired? What things are being suppressed? And why rainbows? Why snakes? And just from there, it was just an academic curiosity. So again, as I started pulling that thread and realizing there are actually quite a few scientific explanations for the mechanisms of action and the pharmacology of all this. And then for me, what was really even more exciting was that place where science sort of fell apart. And then it was just spirituality, mysticism. Yeah. And, Albert Einstein has that quote, if you start studying science for a little bit, you'll stop being religious. But if you keep going and you study science a bit more, you'll come back to religion. And for
that's
me,
so cool,
right? And that was really, that's how it's been. And I think that's what gives these medicines a huge advantage over the drugs we have that just alter brain chemistry. There's no spirit. There's no spirit in there.
Right. That's amazing. What an incredible answer. And I completely agree. So much comes with the psychedelic medicine paradigm. It's not just another drug. It comes with this aspect of meditation and nutrition and yoga and health and compassion for yourself and for others, it's really profound in that way. And it's so necessary today with everything that, we're experiencing and we're going through, not just with the pandemic, but with the fact that it's exposed so much fragility and cracks in the way that we treat mental health, and so it forces us to ask these bigger questions. And I think that's really important, but also equally important is, you're right, we're doing it differently this time. We're not doing what Sandoz did in the 60s and mailing acid to everybody, so they can just use it in any setting they want. And it's inevitable that things go wrong then, because these are powerful substances. No one should mistake it. I don't like to call it recreation, but psycho-spiritual growth and development, because I think everybody has the opportunity to benefit from these medicines, not just people that we label or diagnose as having a mental illness, but to that effect, yeah, absolutely. To that effect, I think it'd be really cool to talk a little bit about the Cme course that you're about to launch. It's super exciting, and I'm really grateful to be able to collaborate with you on this. So tell us more about it.
Well, the course actually, it's the way the course was first created was it was an in-person course, either a full-day course or 2 half-day courses. And it came about after, I'd kind of been speaking at grand rounds and various medical presentations at conferences. And a psychological association backed by the American Psychological Association, the APA, they reached out to me and they said, hey, you want to teach a day-long course? And I thought about it and I was like, I think the answer is yes, but can I fill an entire day with material? And as it turns out, I had way more. Like I had to cut the course back significantly. And, and the course, it was offered shortly before Christmas. And in the United States, everyone just goes hysterical in the month of December. Anyone listening, if you want to give me a job somewhere warm where I don't ever have to be in the United States in the month of December, where do I sign? So
I'll try and find you something here in Mexico.
Yeah, if you're in Mexico, you're a medical director, holler. So this course, it was in the month of December. And so it's a month where people are not really focused on getting their, taking a course. And it was in a hospital, a conference room in a hospital, a room with no windows and a podium. And, the organizer said, if we get 40 people that sign up, we'll be happy. I was like, wow, all this work for, well, okay, whatever. We had over 120 people sign up. So it was pretty clear. And a lot of the people that came were psychedelic naive. They were psychiatrists, they were psychologists, they were primary care physicians. They were like, my patients are asking questions about this and I don't know what to say. I say drugs are bad, stay away. And then I realized that actually I sound like an after school special and that might not be true. And so, the feedback from that course was so positive. And then when the pandemic happened, I realized, and all of this conversation about psychedelics is just getting louder and louder and more studies. And I realized, hey, why limit it to just where I can be geographically? Providers all over the world need to hear this. And so partnering with Microdose has really sort of helped me plug my little microphone into a way bigger amp so that I can, reach more people with this information. And the course is designed for healthcare providers, but people that don't have, training in counseling or in medicine, they'll definitely benefit from the course. People that are just regular folks, working in coffee shops or working in tech, they've taken the course and they've said that they could follow everything, that they got a lot out of it. And I've even gotten feedback from some people who attended the course just out of curiosity and actually decided to change the focus of their careers.
Wow.
Result. Yeah. And then I'm going to brag for 1 second. I also got a very kind email from a clinical psychologist who's also the director of a facility. And she said, I came to your talk because I was skeptical, and I came to your talk so that I could arm myself with counter arguments when my colleagues talk about psychedelics. And you changed my mind. You changed my mind, and I cried during your presentation. And I just want to say this has been within the top 2 or 3 trainings of my life. So it's a darn good course. I know that sounds a little arrogant, but it's like, sometimes you like paint a painting and you stand back and you're like, it's nice, not my finest work. This one, I'm like, nailed it. Yeah. It's a really good course.
I don't know. I completely feel you on that. That's really incredible. I'm so excited to be a part of collaborating with you on it. I'm excited to go through all the modules myself. I think I'm going to find it super interesting. I know I am. And something that really stuck out to me is the plugging into the bigger amp, of microdose. And that's something that I'm really grateful for as well. As I joined in July of 2020, so well into the pandemic. And something that microdose does that just really stands out to me as being so special is that it doesn't matter where you are in the world, doesn't matter what's going on in the world, and if you're stuck at home, we're able to bring people together and share ideas, through our conferences, through conversations like this, from all over the world, even if we're in isolation. And I think that's really important, and that sense of connection that people really long for and need, and that intellectual stimulation of talking about these things is so necessary. And so, microdose has really provided, you and me that, and everyone that platform. And so that's really exciting. I agree with you.
Mm-hmm. Mm-hmm. Yeah, and something that's interesting to me about this course is we have gotten it approved for professional education credits. And when we started this, I was like, wow, I knew it could get approved by the American Psychological Association because this course has been approved in the past, but it's, can we get it through this board? Can we get it through that board? And it's like every professional door that we have knocked on, even the ones that I thought would turn us away, they were kind of like, yeah, come on, we need trainings on this. Where have you been? So we've been very lucky in that regard.
Temporarily disconnected. Okay, you're back.
Okay. Do you need me to repeat what I just said?
Yeah, you said a lot of boards that you didn't even think would, except the course did, and then I lost you.
Yeah, it just seems like every door that we knocked on, there was someone opened it and was very enthusiastic about what we had to offer. So an additional bonus or incentive for healthcare providers is, depending on what kind of provider you are, you may actually be able to knock out some of your continuing education or continuing medical education requirements if you join us.
Wow. So for the people listening, doctors have to get this continuing education as a part of some sort of continuing education as a part of their profession. And so, taking this course, besides stimulating the curiosity and helping them learn about psychedelics, can actually help them fulfill that credit, which is also, such an important thing. So what an incredible thing that you created. I think it's so super cool that, you're launching it. I'm curious, what do you see, in the future as we move forward 5-10 years from now? I know some companies are developing psychedelic derivative drugs. We're still trying to figure out setting for some of these compounds. We're getting some idea what that looks like through ketamine-assisted psychotherapy, since ketamine's kind of been the Trojan horse of psychedelic medicine. Once you realize it's more than just an anesthetic. So we're still understanding a lot, and we're still trying to forecast a lot. But I'm curious what you think that looks like.
Well, I think acceptance is what it looks like. I think it's a matter of time. I will say I am based in Oregon. I was very involved in advocating for ballot measure 109. Yeah. So we have the first state in the United States that has legalized, not just decriminalized, but legalized psilocybin-assisted therapy. It's going to be another 2 years before that actually takes an effect, because the state has to develop the program. And I intend to support that in whatever way that I can. But, and invariably there's a flood of financial interest in this. People want to invest in this. People want to make money like they did off of cannabis, for example. And so, there's potential here for people to, advance their careers and make money as well. But I also think what we're looking at here is a paradigm shift, where in our culture, we have really separated our spirits from the rest of the facets of our lives. And I sometimes joke, I know this is a little snarky, but I joke that science is the religion of people who think they're too smart to need religion. And we really, really value the concrete in this culture. We don't really value that which we can't see. And what I think is going to happen as more and more individuals realize the place of these medicines is we're going to realize the place of our own selves and the place of our own spirits. And I know I'm getting a little woo and a little out there.
No,
I'm not saying we're all going to quit our jobs and grow our hair out and wear tie-dye and frolic in the woods, but I think that there won't be quite as rigid of a separation between this kind of experience, and I think we'll have a more fluid gamut of experiences and healing opportunities in our society. And, is the reason that we have such a high rate of depression. It's almost 20% of individuals have some kind of mental illness, right? That is out of control. 20%? Are you kidding me? And 30% of them don't respond to antidepressants. Yikes. So what on earth is going on, right? There's a big disconnect. And I think that as we invite psychedelics into their rightful place in medicine and society, that we will see that gap closing. I think we will see less mental illness. Now, I want to be absolutely clear. I am not one of those people who is this. I don't think everyone needs to do psychedelics. I don't think everyone needs to do psychedelics. I don't think people need to do psychedelics all the time. When I get to know people socially, they often comment on how surprised they are at how infrequently I take psychedelics. If we talk about these things as if they are medicine, then we know that any medicine has its time and its place and its indications and its contraindications. And I think that as we learn more and as we accept these medicines more, we will be able to understand them better and therefore guide people on how to stay safe to the medicine that they need, so that they get the experience that they need and not the experience they don't.
Yeah, that's absolutely true. And it's so important to talk about the cautiousness that's required and the contraindications, like you said, and the fact that we are really touting the benefits because they are really profound. The studies that we're doing are showing that this is a real deal, and it's going to help so many people, and that's amazing. But you're right, it needs to be done carefully and it needs to be done cautiously. Because like we talked about, this is powerful medicine, and they're just powerful and they're amoral, right? They're just that's what they are for sure, as they're powerful. Whether they're good or bad is the context and the intention in which they're used in, right? And so establishing that beforehand and talking about safety is really crucial. I assume that's a part of the course as well, right?
Absolutely. Yeah. In every medicine which we talk about, there is a whole section on safety, on drug-drug interactions, on contraindications and cautions, and on troubleshooting. So what happens if you give somebody 100 milligrams of MDMA and then their blood pressure shoots up through the roof? Then what? Then what do you do? Definitely offer some suggestions on there. And I'll also mention the medicines that we talk about in the course include psilocybin, LSD, ayahuasca, ibogaine, ketamine, and MDMA. And then there's also a module just on microdosing and a module just on psychedelic harm reduction and creating the ideal therapeutic atmosphere and environment. So although the course it's not meant to be like a certificate where if you finish this course, you can now be a psychedelic therapist.
Right.
Some suggestions are offered there, at least an introduction is given to that, to help providers, yes, if they're going to do this work, at least get a taste of how to do it more effectively, or if they're going to start referring elsewhere, to know what to look for when they pair with someone who's doing this work, whether above or underground. How do you know this person's good? How do you know this person's going to take good care of your patients or your clients? And there's one of the entire modules is focused just around addiction. So there's an entire module exploring, the psychedelic treatment of addiction, which seems counterintuitive. You're using a drug to treat drug. We do it all the time, right? What's methadone?
Right. Exactly.
What's buprenorphine? We're using drugs to treat addiction. What's Prozac? What's Xanax? Those are all drugs, right? We use drugs to treat addiction all the time.
We do.
So Yeah. So just kind of switching the paradigm of how we think about these substances. And are they a hill of fun? They can be, depending on how you take them, but that's not the focus of the course.
And that's the funny thing is that it's not guaranteed either. I think that's the big thing. That's a big difference with psychedelic medicine versus other drugs that have been looked at as recreational. Is that these other drugs, heroin, methamphetamine, they're predictable. You know what you're getting into. Usually, if it's not your first time doing it, if you're an addict, for example, you know what's going. That you know what you're chasing, and it's a sort of a repeatable experience. With psychedelics, it's not like that. First of all, with tolerance, so you're not really able to take them every day. But even if you take them infrequently, the fact of the matter is you don't know what's going to happen. You're taking a whole macro dose, right? Like that, you're going into the unknown, and that stepping into the unknown is part of what makes it so therapeutic. Part of what makes it have its own defense mechanism against abuse, I guess, is one way to look at it. Almost as if like the OxyContin makers made it so you can't crush the pills so easily and inject them. Right. It's kind of like they have their own consciousness and their own anti-abuse mechanism in that way. But on a bigger scale, on a more metaphorical level, they're causing us to rethink the way we look at a lot of conditions and just ourselves. Rethink everything, let's be honest, But yeah, for example, with addiction, using drugs to treat addiction, like, you're right. We do already do that, and it's not terribly effective. Patients, sure, like buprenorphine, methadone, they have clinically they've shown to have success versus considering patients are using heroin and now everything's laced with fentanyl and people are dying. Of course, but I know a lot of people that would love to get off of those substances. Would love to live a life that's not, with liquid handcuffs, for example, and I completely get that. So it's so powerful and amazing that your course covers all of these topics and all of these subjects. As we're nearing the end of our conversation, I guess, what are you most excited about? As this psychedelic renaissance continues to ample forth, what excites you most, and what are you looking forward to most?
Wow. What excites me most is, I believe that people can change. I believe that people can grow and heal and evolve and press into life and love life. And if I didn't believe that those changes were possible, I wouldn't have become a healthcare provider. And so I really personally, I like being in the front row and getting to witness people's aha moments. They go, oh, whether it's just like me teaching my nephews a little something, or it's a person realizing like, oh my God, I'm worthy of love. Wow, I had no idea. And now I know. And then their face is covered in tears. And, a lot of this work, when I do facilitation of psychedelic experiences for clients, it reminds me a lot of the work that I used to do when I would attend home births. So I used to assist at home births where women would labor and deliver their babies in their homes. And there's something about this work that really reminds me of that, of like, we don't know what's going to happen, but I know that something's going to be born, and the person might flow through it really blissfully, or it might be really hard. There might be some tears, there might be some vomit, there might be some poop, and that's okay, And like, I couldn't go to a birth without crying. I cried at every birth. I cry at every trip. Something profound happens. Something beautiful always happens. And to get to be there to witness that, I'm like, I want to cry right now. I'm getting goosebumps like that.
It might be the first time I've been a little emotional in the podcast, but wow, you're really blowing me away. This is awesome. What a great conversation.
It is such a gift. It is such a gift. And so what I would really love to see happen is, people are aligning with this medicine. People are so desperate for this medicine, for healing. And until this medicine is legal, people are going to do whatever they can do to heal. And sometimes that means that they are going to access medicine in ways that aren't as safe.
Yeah.
And that makes me concerned.
That's something you brought up. I want to comment on, actually, is that concept of birth and rebirth. It's such a integral part of the psychedelic experience, especially with things like Ibogaine. It can feel kind of scary after the experience because neural pathways for addicts, a lot of Ibogaine is primarily used today for addiction, primarily to disrupt, the pathways with opioids mainly, but it's used for a lot of different compounds. And that experience after the flood dose of just being reborn is a scary kind of like I'm in this world, this big world, and I don't know what to do. And to have someone to facilitate that and help you through it is important. Ibogaine comes with risks, it comes with potential cardiac toxicity for some people. So the fact that not everyone can make it, for example, to Mexico and go to a clinic that's been really well rated with really good providers. Some people do it underground in the United States where it's completely illegal still. So to the people out there that want to access psychedelic therapy and maybe have to go through an underground channel, what is your advice to them, and what are your thoughts on that?
Whew. Well, that's where harm reduction comes in. That's where harm reduction becomes really important in terms of, there's no shortage of resources now, and we do talk about this a bit in the course, but I will say Jim Fadiman's book, Psychedelic Explorer's Guide, fantastic resource. Another great book is Michelle Janickian's book on your psilocybin mushroom companion.
She's awesome. I love her.
She's awesome. I'm also quoted in the book.
Nice.
But yeah, those are good resources to start with, and trusting the people you're with. Most important thing. Part of why I came to psychedelics so late. I mean, I'm not exactly an elder, but I think I came to psychedelics later in life than a lot of my peers did, and it's because I always had this policy: I'm not going to take anything with people I don't trust.
Sure.
Period. I'm not going to take a new substance in a setting in which I don't feel safe with people I don't trust. And the people that had the drugs I wanted to try, I didn't trust them. And the people I trusted didn't have the drugs I wanted to try. So, I had to wait. I had to wait until I had money.
Yeah,
do it a different way. So I don't know where I was going with that. But the safety bit is what's the setting? What's your mindset? Do you feel safe? Are you safe? Do you trust the people you're with? Do you trust the drugs you're taking? I also want to plug dancesafe.org. They sell drug testing kits. Buy them, use them every time, use them on every batch. Yep. If you are
not just on
heroin,
psychedelic drugs too, exactly. You use them on all the drugs, everything, especially cocaine, heroin, pills and press now. It's so dangerous out there. It's not the same as it was in the 60s and 70s.
No. Yeah, it's different. And now, especially with fentanyl, if you have heroin, you don't just want to test a little bit of your bag. You need to test the whole bag because of that, they call it the chocolate chip cookie effect. So like if you have let's say this is a bag of heroin that you purchased and you test from here and it shows there's no fentanyl, well, there might be fentanyl here, here, and here.
Wow.
And if you draw up from this part of the bag and you inject all that fentanyl, you're going to meet your maker, maybe when you weren't planning to. So yeah, drug testing, hugely important. I'm very proud to be from Oregon. I'm very proud that we just decriminalized pretty much every drug in small quantities and that we just legalized psilocybin-assisted therapy. So it's a super exciting time. I also just want to say my parents, I love my parents so much. I need to give them a shout out. They know everything that I do. They are... And I also will say that they are Russian immigrants. I'm a first generation American. So this is way beyond the pale of anything for them. And, over the years, my dad periodically just pushes his glasses up and he's like, so when can you make a career out of this? So what are you
man,
when are you going to be able to make some money doing this? And it's like, yay, it's here.
We have a lot in common there, Dr. Erica. I'll tell you what. So shout out to my wonderful parents as well. We're me included. We're first generation immigrants from India to the United States. And the same story as far as their perception of what I was doing, kind of how all that went. It started with working in cannabis, and finally, I'm very grateful now to be with microdose. But yeah, that's really funny that you say that, and it's really cool that even people like our parents, like they can begin to shift the way that they look at these substances. And so like we live in such an exciting time. I'm grateful to be alive now when I am, to be able to connect with people like you that are at the forefront of this movement. I'm sure you know Sam Chapman very well,
Oh, yeah.
Yeah, that's super cool. He was at one of our psychedelic capital panels, and I was really stoked on election night, way more interested in the outcome of Measure 119, and it was really great I had two blogs going. I was like, one was like, well, they made a really novel effort, but they failed. But I was really working on the one that was like, we did it, Oregon passed the measure, and it was really cool.
It was really close.
Cool.
It was a nail biter. Yeah. I really didn't. I was like, I don't know. Maybe this will pave the way next time. And we did it.
Yeah, we did.
People are ready for something different.
Yeah.
We have run out of drugs. There's not a lot of new drugs in psychiatry, not a lot of new treatments for depression and anxiety going to market. We need something different. And when you look at the recidivism rates or the relapse rates for addiction treatment, yikes, not good. So hopefully this will be something that helps a lot of people that really need it.
It seems like that's going to be the case, and we're really lucky to have people like you to get out there and educate others in your field, educate providers, clinicians, doctors, the people that society will be going to access these medicines legally, thankfully, soon, and be able to get the treatment they need for suffering that they've gone through for so long. And I think it's really incredible to be able to just be any part of this. The small part I play and the privilege I have to speak with you tonight. It's been really amazing, Dr. Zelfand. I always give the mic I always give the mic to the last word to my guests before we kind of sign off. And so if you have a message or anything you'd like to share before we, say goodbye, this is your chance.
Ooh, yeah, sure. This may or may not have anything to do with psychedelics. Maybe the listeners can decide.
Sure, no, it doesn't have to.
So I recently heard this little story that I thought was beautiful. I'd like to share it with you, where it's actually not a story. It's apparently how lobsters grow. So a lobster has a shell, and unlike a hermit crab sort of finds a shell and goes and lives in that different shell. A lobster actually makes its own shell. And the way that a lobster knows that it's growing and that it's time to make a bigger shell is as it grows, it starts pressing into the walls of the shell that it's in. And that's a very uncomfortable process. That can be even painful. But that pain and that discomfort is a signal to the lobster, hey, I'm growing and it's time for a bigger shell. And that's when it's the lobster's time to shed the shell that it's in and go hide under some rocks and be a lobster without a shell and create a bigger shell for itself. Now, if that lobster was getting the pain signals and that discomfort that it was time to grow, but let's say we gave that lobster something to dull that experience, right? Like a lot of the medications we give people dull their experience. And this is not to pill shame. I prescribe antidepressants and benzodiazepines. They are a lifeline, okay? I'm not saying that. Some people really need them. I prescribe antipsychotics, okay? But
sure.
If we dull the signal that growth is happening, that lobster is not going to go and make itself a bigger shell. It's going to stay in the shell that hurts, and it's going to keep hurting, and it's going to need to continue taking something to dull. So if you're listening, maybe think about what that might be like in your life. Where are you kind of pressing into the walls of the shell and being invited to grow? And are you leaning into that, or are you dulling it? And just see what comes up.
Oh, that's really, really incredible. I can't wait to speak with you again. We're really excited that you're going to be at the iBegan conference this Friday, Saturday, when we have it.
Me too.
And I really I have to have you on my show again soon because
I love that.
This was amazing. I love all the wonderful people I've had the privilege to speak with, but this was, I think, a really special episode and a really wonderful talk. So thank you so much, Dr. Erica, for joining us in this episode of Sci-Fi. I appreciate it. Thank you all for listening. This has been another episode of the Sci-Fi Podcast, where we talk to leading industry experts, clinicians, and researchers to unravel the mystery that is psychedelic science. We spoke with Dr. Erica Zelfand today, and please, find us on iTunes, YouTube, and Spotify, and leave us a review because that helps us kind of gain some momentum. And what a great episode. Thank you all for joining us today.
Garv, thank you so much for having me. This was a delight.
Thanks for joining the Sci-Fi series, brought to you by Microdose and the Conscious Fund. Visit our website at www.microdose.buzz.